start by palpating the scalp, feeling for any lumps, bumps, or abnormalities along the scalp. I don't feel any there. I'm going to continue the exam by doing the same palpation across your face, feeling for any lumps, bumps, abnormalities on the face. And while I'm here, I'm going to palpate the sinuses. Do you feel any pain, pressure, or discomfort when I do this?
No. Okay,
that's a good indication that you don't have sinusitis. I'm then going to assess the cranial nerves. If you could puff out your cheeks for me. All right, and then clench your teeth. Good, and then burrow your forehead. And then keep your eyes closed, and I'm going to try to open them. Good, perfect. All right, next I'm going to move into exam of your eye. I'm going to start with the surrounding structures. I'm going to examine your eyebrows, your eyelashes, your eyelid, the sclera for any signs of inflammation or bumps in the eyelids such as sty, which could be an infection. Any pain in the eyes? All right, good. Next, I'm going to be assessing your ocular movements. So you're going to keep your head still and follow this pen with your eyes only. Good. Perfect. All right. Next, you're going to tell me when my fingers come into view. See? Yep. See? Okay, now you're going to cover one eye, and then you're going to tell me how many fingers you see me holding.
4, 8.
And now cover the other eye.
6, 8.
Good. Perfect. All right, next I'm going to be checking your reflexes of your pupils. You can just look ahead. Good. And then I'm going to put my hand here and observe the opposite eye. Good, perfect. Next, I'm going to be doing a fundoscopic exam. All right, I'm going to be looking into your eye. Just look at my ear for me. And here I'm going to be assessing the retina, the optic disc, and checking for that red reflex on both eyes.
That's really good.
All right, next I'm going to have you look directly into the light, and I'm going to be checking the macula. Good. Sorry. Good. Perfect. All right, next I'm going to be moving on to the nose. I'm going to palpate the external nose, and I'm just going to be checking for any lumps, bumps, abnormalities. And then I'm actually going to be using my light to look inside the nose. And here I'm going to be checking the... Here I'm going to be assessing for any inflammation in the sinus or any postnasal drip or discharge coming out of the nose or any inflammation or swelling inside the nose, and it all looks fine, as well as the external nose looks fine. I'm going to move on to the lips. I'm going to start by assessing your external lips, looking for any signs of blisters, lesions, sores, cracking, discoloration. You can open your mouth, and with your mouth open, I'm going to look at your teeth. I'm going to look at your gums. I'm going to look at your cheeks and your tongue. If you could stick your tongue out and say, ah. Good. And I'm going to look at your uvula and also assess your tonsils in the back for any signs of inflammation in the lymph nodes there. Good. If you could stick out your tongue and put it in all 4 directions and then in a circle. Perfect. Next, I'm going to assess your ears. I'm going to start with the external ears, and I'm just going to be feeling around to make sure that there's no lumps, bumps, abnormalities. And then I'm actually going to assess your internal ear, and what I'm going to be looking at here, I'm going to pull the ear up and back. I'm going to be looking at your tympanic membrane, as well as assessing for any swelling or inflammation or fluid in the ear, or swelling and inflammation in the canal. All right, and I don't see any inflammation in the canal, and the tympanic membrane looks normal. All right, I'm going to stand behind you, and I'm going to have you cover one ear, and I'm going to whisper something, and you try to repeat what I say. 4, 3, water. Yep, and we'll do the same on the other ear. 7, 1, dog.
7-1 dog.
Yep, perfect. All right. While I'm here, I'm just going to quickly do a strength check. If you could push your shoulders up and I'll push them down. And then if you could lean your head to the side and I'll push it up. Good. And the other one. Good. Perfect. Next, I'm going to do a test called Weber and Renee. Let me know if you feel something.
I do.
Do you feel it more on one side, more to the other, or equally?
The same.
And do you feel any pain? No. Okay. I'm going to go to the back of you, and I'm going to put this on your mastoid process. Do you feel anything?
I do.
All right. Let me know when it stops.
It stopped.
All right. And do you hear anything?
I do.
And let me know when it stops.
It stopped.
Okay. And same thing on the other side.
It stopped.
All right.
And it stopped.
All right. So here we have that air conduction is greater than bone conduction, which is normal. All right. While I have this, I'm going to do a sensory check. So you're going to close your eyes and tell me where you feel this, okay?
My face. My chest. Thumb. Right thumb. Left thumb. Right knee. Left knee. Right ankle. Right ankle. Left ankle. Toe. Left toe.
All right, good. Next, I'm going to go back behind you and I'm going to be assessing your back, just doing an overall general assessment first, just assessing the general appearance and also palpating for any signs of abnormalities. And then what I'm going to do is assess for Cva tenderness. Do you feel any pain there?
Nope.
Any pain there?
Nope.
All right. When you feel my hands on your back, say the number 99.
99. 99. 99. 99.
All right. And then as wide as you can, take a good deep breath for me. I'm going to be measuring chest excursion one more and seeing how far my fingers are spreading apart. Good. I'm going to percuss the borders of your lungs. Good. And then lastly, I'm going to just listen to your lungs from the back. Just take nice deep breaths whenever you feel the stethoscope on your back. Perfect. Now I'm going to come over to your front and I'm going to be doing an assessment of your neck. I'm going to start by palpating the neck and I'm going to be feeling for any lymph node swelling or abnormalities in the neck, lumps, bumps. And while I'm here, I'm also going to be assessing your trachea to see if there's any deviation from midline. I'm also going to assess your thyroid to see if I see any signs of nodules, goiters, swelling, or abnormalities in the thyroid, which none is noted. I'm going to move on to your chest. I'm going to start by general palpation. I'm going to be assessing for thrills and heaves. And I'm also going to be assessing the PMI.
Scapula elevation. So you're going to bring your shoulders to your ears. Okay, now do that again. Don't let me move you. Okay, and that's a grade 5. Now we're going to do shoulder flexion. So you're going to bring your hand, palm down, all the way up. Perfect. Now you can do that again and stop at shoulder level. I'm going to apply some pressure. Don't let me move you. Okay, and that's grade 5. Now we're going to do shoulder abduction. So now you're going to bring your hand this time around to your side and all the way up. Good job. Now you're going to do that and stop around shoulder level. I'm going to apply some pressure. Don't let me move you. And that's a grade 5. Now we're going to do elbow flexion. So I'm going to have you bring your hand to your shoulder. Perfect. Okay, go ahead and do that again. I'm going to try to pull your arm down. Don't let me. Okay, and that's a 5. Now we're going to do shoulder internal rotation. So go ahead and try to bring into towards your stomach. Okay, now go about halfway. I'm going to try to break you. Don't let me. Okay, and that's a 5. Now we're going to do shoulder external rotation. So now you're going to bring your arm out. Good. Now about halfway, I'm going to apply some resistance. Don't let me move you. Okay, and that's a 5. Now we're gonna do forearm supination and pronation. So we're gonna start off in neutral, and I'm gonna have you pronate. Okay, good. Now you're going to try to bring your hand down to the floor, and I'm gonna try to resist it, okay? Okay, and that's a 5. Now we're gonna do supination, where you bring your palm to the ceiling. Now you're gonna try to bring your palm to the ceiling, and I'm gonna try to resist you down.
Okay.
Go. Okay, and those are both 5s. Okay, so now we're gonna go into a hip flexion. So you can go ahead and put your hands here to support you, and try to keep your hip down while you lift your knee up to the ceiling. Okay, good job. Go ahead and do that one more time. I'm gonna apply resistance. Don't let me move you. Okay, that's a 5. Now we're gonna do knee extension. So you're gonna kick your knee out. Perfect. You're gonna do that one more time. We're gonna make sure your knee's not locked, so we're gonna lower it a little bit. Now I'm gonna apply resistance. Don't let me move you. Okay, that's a 5. Now our last two are gonna be hip internal and external rotation. So for external rotation, I'm gonna have you bring your foot across here and that foot out of the way. Perfect. Go ahead and do that again. I'm gonna apply some pressure. Don't let me move you. Now for hip internal rotation, I'm gonna have you bring your leg out to here. Good. Go ahead and do that again. I'm gonna apply pressure. Don't let me move you. Okay, great. And both of those were 5s. So now we're gonna move into the supine, laying on your back. Okay. And we're gonna start with cervical flexion. So what you're gonna do is you're going to tuck your chin in while you're still looking up at the ceiling, and then you're gonna lift your head up. Perfect. Relax. Okay, go ahead and do that again. I'm gonna apply some pressure. Don't let me move you. Okay, and that's a 5. Now we're gonna do cervical rotation. So I'm gonna have you turn your head this way. Perfect, go back to neutral. Now I'm gonna have you go about halfway. And now you're gonna try to bring your head back to neutral. Don't let me move you. Perfect, that's a grade 5. Next one is going to be trunk flexion. So what you're going to do is you're going to lightly put your hands behind your head, and you're going to lift your upper body up so that your full scapula or shoulder blade is all the way off the table. And I'm gonna hold your lower legs. Okay. Go ahead. Okay, and that's a grade 5. Now we're gonna do trunk rotation. And for this one, you're going to bring this elbow to the opposite side and lift the scapula off the table as well. So go ahead and perform that motion. Perfect. That's a 5. Okay, so now we're gonna do shoulder horizontal abduction. So I'm gonna put your hand in the position so you can see what it is. You're gonna go into that position.
Okay.
Okay, so go ahead and go into that motion. I'm gonna apply some pressure. Don't let me move you. Good job, that is a 5. Now we're gonna move down to the feet. If you wouldn't mind coming down to the edge of the table, I am going to do dorsal flexion. So go ahead and lift your toe up to the sky. Relax, do that again. I'm gonna apply pressure, don't let me move you. Good. Now we're going to do ankle inversion. So go ahead and move your ankle in like so. Good. Go ahead and do that motion again. I'm gonna apply resistance, don't let me move you. Okay, that's a 5 as well. The dorsal flexion was a 5 too. Now we're gonna do eversion, so we're gonna move your ankle out. Go ahead and perform that motion. Okay, do that again. Good, that is a 5. Now we're gonna do toe flexion and extension. So we're going to start with bending your toes in. Good. Go ahead and do that. I'm going to apply some resistance. Don't let me move you. Okay, and that's a grade 5. Now we're going to extend your toes up to the sky. Good. Go ahead and do that again. I'm going to apply some pressure. Don't let me move you. Okay, and that would be a grade 5 as well. Now we're going to move to sideline. And we are going to start with hip abduction. Okay. So I'm going to hold your leg and you're going to relax it into my arm. Then you're going to bring this leg up here. That's right. More in the motion. Okay, you're going to do that again, and I'm going to apply some resistance. Don't let me move you. Okay, that's a grade 5. Now we're going to flip you onto this side so that we're testing the same leg while we do hip abduction, abduction. So for this motion, I'm going to have you lift your leg up to the sky. Good job. Go ahead and do that again.
Okay. All right, I'm going to go ahead and let you grip my fingers here. Squeeze nice and tight. Good. Go ahead and pull my fingers towards you. Good. Push them away. Perfect. Okay, go ahead and let go for me. Roll your shoulders for me. Okay, good. Can you push them up towards your neck and let them fall back down? Good. Okay. Can you roll them backwards? Good. No pain with that at all?
No.
Okay. I'm going to check your elbows now here. Can you lay your arm rest down to the side on the left side there? Pick it up for me. Good. Put it back down. Pick it up. Put it back down. Perfect. Same with the right arm. Can you pick it up? Put it back down. Pick it up. And put it back down. Same with the wrists. Can you roll them forward for me? Okay. Now backwards for me. No issues with that? Don't have any wrist issues?
No.
I saw that you had a previous break at some point in the right side. That doesn't cause you any problems?
No.
Okay, good. All right, next I'm going to check your eyes. Just kind of a quick vision assessment. If there's anything that is abnormal, we can always refer you to a specialist, but this is just like some wider picture studies here so we can just get an evaluation on you, okay? Now, do you have any vision issues? Do you wear glasses or contacts?
Nope.
Okay, good. Go ahead and just look forward at me. I'm going to have you follow my finger with just your eyes. Beautiful. Okay. Look forward at me. Now, one at a time, I'm going to close one of your, or cover one of your eyes, and I'm going to put some fingers out to the side, and I just want you to tell me how many fingers I'm holding up while you're looking forward, okay? Start with your left eye here. Look forward at me.
2.
Sorry, I didn't touch your face.
3.
Okay, good. Look forward at me. Right eye here.
3. 4.
Perfect. Okay. No issues with that? Doesn't seem blurry to you at all?
Nope.
Okay, perfect. Look at your eyes with a bright light here initially, and then I'm going to use another device called an ophthalmoscope to look a little bit deeper in your eye too, okay? Just look past me on the wall there. It's just going to be a bright light real quick. Okay? Good. All right, now look forward. I am going to have to touch your forehead, okay, just to let you know. Just nice and quick, just looking for a little red light in there. Everything looks good. Like you said, you haven't been having any eye issues, so that's good for us. Okay, now I'm going to check out your head here. I'm putting on some gloves. I am going to touch your face. Have you been having any pressure in your face at all, or any sinus issues?
No. A little bit of sinus drainage.
Okay, well, we'll check out your throat here in just a sec. Okay, I'm going to palpate. No pressure here. Palpate pulse speed. Okay. Go ahead and clench your jaw for me. Good. Open your jaw like this. Perfect. I'm going to palpate your lymph nodes here. Your preauricular, postauricular, tonsillar, posterior cervical chain, deep cervical chain, supraclavicular, and occipital, submandibular, submental. This feel okay. We'll palpate your scalp here. No bumps or bruises. Didn't take any tumbles lately.
No.
All right. Do you do a lot of bike riding?
Sometimes I do.
You always wear a helmet?
Of course.
Always got to wear a helmet. Okay. Now I'm going to look at your ears, your nose, and your throat. So we'll start at your nose. Can you look up towards the ceiling? Okay. Do you have nosebleeds often or not have any trouble with the nose? You can breathe out the nose fine?
Yeah.
Perfect. Well, they look good. Okay. Go ahead and open your mouth nice and wide. Okay. Stick out your tongue. Say ah. Okay, good. Your throat looks a little red, but it looks okay. There's not a lot of swelling in your I see you still have your tonsils. Show me your teeth. Good. And your gums. Teeth are nice and bright and white and pretty. All right. Look forward here. I'm going to look at your ear, okay? I'm going to use a device called an otoscope. I'm going to pull on the back of your ear here. Okay. Sorry, I'm trying to catch your feet in this chair here. These stools are so low. Perfect. Alright. Next I'm going to check your back here, okay? I'm just going to feel your spine. Can you move your hair out of your way? Thank you so much. Any tenderness at all?
Nope.
Okay. Just going to kind of tap along this. No issues there.
No.
Can you roll your neck around one way? Now roll it around the other way. Perfect. Good. Can you look forward at me? Can you puff out your cheeks? Okay. Raise your eyebrows. Close your eyes real tight. Alright. Looks good. Alright, I'm going to have you lay flat on the bed here. Actually, before you do that, one more thing here. Just going to check out your thyroid. Reach around you here real quick. Okay. No neck swelling at all. Feels good. Okay. Go ahead and lay back. Get you about 30 degrees here. Perfect. Get comfortable here. I'm just going to look at your neck first. Can you look to the right? Okay. Go ahead and look to the left here. Perfect. Oh. I'm going to listen to your neck next, okay? You look to the right. Okay. Can you look to your left for me? Get a lot of the neck work out here. Okay. I'm gonna have you just look up towards the ceiling, okay? I'll put a ruler on your chest here. Right. While I have you laying down, I'm gonna listen to your heart, okay?
Mm-hmm.
I'm gonna have you roll on your left side. Okay, I'm gonna listen to your heart in one more position. Sorry, I know the pillows are kind of uncomfortable. Just the best way to listen to the apex of your heart here. Okay. While you're laying there, I am gonna palpate here just real briefly. Okay, good. Can you lay flat? Sorry, I know these pillows are crazy. Alright, I'm going to palpate on your chest, okay? Do you have any tenderness at all?
No.
Okay. You don't have any issues? Your heart never feels like it's racing or beating too fast?
No.
Okay. I'm going to look at your belly here. I'm going to have you pull your shirt up just slightly. Get the strings out of the way. I'll listen first, okay?
Mm-hmm.
I'm going to palpate lightly here. Tell me if you have any tenderness, okay?
Mm-hmm.
Deep. Okay. I'm I'm gonna tap on your tummy here. Okay, take a big deep breath in for me. And out. Okay, I'm gonna feel right here. I'm just feeling for pulses, okay? Okay. No hip or any swelling in here at all that you know about? Okay, you can pull your shirt back down. I'm gonna have you sit up.